Dr. Morrison has expressed her ongoing concerns with the number of non-island residents traveling unnecessary to our province for personal reasons. During a time when we were doing everything we can to flatten the curve and contain the spread of COVID-19 in our province, any unnecessary travel to our province is a concern that we all share. Yesterday, Dr. Morrison was quite clear in her direction that visitors and cottagers should not be traveling to P.E.I. until at least the end of May. Recognizing that we need to step up our enforcement efforts to support Dr. Morrison's direction and further protect Islanders, I've reached out to my counterparts in New Brunswick and the federal transportation colleagues today and expressed my concern over the number of non-resident and non-essential workers that are crossing our shared border with the United States, and asked that stricter screening enforcement be put in place. It's important that we work together to ensure that only those who need to be crossing our national and provincial borders are doing so that we can keep Canadians safe during these exceptional times. To that end, we will be stepping up our traffic screening and enforcement measures at the Confederation Bridge. Starting tonight, using highway safety and other law enforcement officials, we will be thoroughly screening all travelers coming across the bridge. Travelers who are not essential workers commuting to P.E.I. for work, essential workers in the trade and transportation sectors who are moving goods and people across borders, such as truck drivers, Islanders returning from travel out of province or medical appointments, or students returning home, or individuals coming for compassionate grounds will be turned away at the bridge. Let me repeat that. Don't come if it's not essential. You are going to be turned away. Travelers will continue to be screened by public health after they go through the first screening. As I mentioned earlier, these are exceptional times. We know that Islanders are concerned and anxious, and we are working hard to practice what the Chief Public Health Office has asked us to do.